everyone, this is Rachel Garcia and I'll be discussing you coronavirus disease or COVID-19 disease. The disease that alarmed the world and affected about 123 countries and territories and has infected about 23 million people in the world and has killed about 800,000 people. uh, the disease that challenged the world in 2020. COVID-19, okay, is also known as your novel coronavirus. Um, because naming a pathogen from a region was stigmatizing the geographical ramification, the World Organization made a point to exclude the term Wuhan in China in naming the current pandemic disease, though it was first discovered in Wuhan. The SARS-CoV-2 virus name followed the standards in International Committee on Taxonomy of Viruses after genetic sequencing revealed that it is most closely aligned with that of the SARS-CoV or your SARS-CoV-1. Coronavirus is an infectious disease and it is caused by SARS-CoV-2. The SARS-CoV-2 comes from family of viruses, and the virus is also known as with spikes, okay, and that allows easy attachment to human being. Now, how do we get SARS-CoV-2 or COVID-19? It is believed that coronavirus originated from the bats and cross-species transmission happened to other animals or by way of zoonotic transmission from animals like pig, wild bird, chicken, cat, bat, dog, seal, horse, camel, cattle, goat, and sheep to human transmission. And this can also be from the livestock of wild animals that has been sold in the market, okay, that is being consumed by human. And also another way by which we can contract the disease is human to human transmission. Let's say, for instance, a positive patient has been hospitalized, we can acquire nosocomial infection, so we can infect healthcare workers and other patients confined in the hospitals. That is why part of our protocol is we prevent um, patients' significant others to care for their patients who have been infected with COVID-19. More so, we can acquire the disease by way of community contact. That is why we prevent mass gathering, we prevent we prevent classes or face-to-face classes. We stop traveling from one place to the other, and we also encourage or require people to do safety measures, health safety measures, like wearing the face mask and wearing the face shield and performing hand hygiene each time that we touch the surfaces that has been infected by the virus. We can also do certain disinfection and certain sterilization of the things that we use. It is said that coronavirus or COVID-19 can be transmitted via droplet transmission in close contact within 1 meter with someone who has respiratory symptom. Example, when they are coughing or sneezing, and is therefore at risk of having his or mucus, okay, get exposed to potentially infected respiratory droplets. Transmission may also occur via fomites in immediate environment around the infected person. Therefore, transmission of COVID-19 virus can occur by direct contact with infected person and indirect contact with the surfaces in the immediate environment or with objects used on infected persons, such as the stethoscope or thermometer, the BP apparatus. Although it is not yet confirmed, WHO has entertained the idea that COVID-19 can also be transmitted via airborne transmission. There are specific instances and settings in which procedures or support treatments that generate aerosols are performed, like, for instance, endotracheal intubation, bronchoscopy, open suctioning, administration of nebulized treatment, manual ventilation before intubation, turning the patient to the prone position, disconnecting the patient from the ventilator, and such as non-invasive positive pressure ventilation, tracheostomy, and cardiopulmonary resuscitation. So all those care being given to the patient will basically predispose our healthcare frontliners to be at risk to develop the disease. That is why universal precaution has to be observed, strict hand washing, and wearing of PPE has to be implemented all the time. Now, how do we diagnose a person suspected of COVID-19? There are two tests available. We have the viral test and the antibody test. The viral test checks samples from the respiratory system, such as swab, okay, and inside the nose to see if you are currently infected with the SARS-CoV-2, the virus that causes the COVID-19. Results from point-of-care tests may be available at the testing site in less than an hour. Other viral tests may be sent to laboratory for analysis. So if you may recall back in early detection of SARS-CoV, we do not have facility yet for the laboratory analysis of SARS-CoV-2. That's why the turnaround time takes a lot of number of days. Some jurisdictions are experiencing a high demand for testing, which causes a delay in processing tests and provide results also in delay. Another one is the antibody test, which checks your body by looking for antibodies, which may tell you if you had past infection with the virus that caused COVID-19. Antibodies are proteins that help fight off the infection and can provide protection against getting the disease again, or it is what we call the immunity. Antibodies are disease-specific, for example, measles antibodies to protect you from getting measles if you are exposed to it again. But don't you worry, they won't protect you from getting mumps if you are exposed to mumps. Except instances in viral testing is delayed, antibody tests should not be used to diagnose a current COVID-19 infection. There has been a clamor nowadays that an antibody test may not show if you are a current COVID-19 infection because it can take about 1 to 3 weeks after infection for your body to make antibodies. To see if you are currently infected, you need a viral test. That is why the antibody test, or what we call the rapid test that we have been doing, has increased the volume of diseases or cases in the country, and many medical professionals are protesting against it. They highly discourage the utilization of the rapid test. They go for the viral test instead. it is said that the viral test can identify the virus in samples from your respiratory, such as swab test inside your nose or your mouth. Okay, so that is how we diagnose COVID-19. So the patients infected with COVID-19 can have symptoms or become asymptomatic. So if you are asymptomatic, you turn positive in the viral test, but you don't manifest the signs and symptoms. So meaning to say your body is capable to fight against the infection. So your immune system resists the infection or the signs and symptoms. But most common symptoms can come from fever, dry cough, tiredness. Less common symptoms may have somebody aches and pains, sore throat, okay, loss of taste, sense of taste, diarrhea, conjunctivitis, headache, loss of smell as well. For some other races, rashes on skin may occur and some discoloration on the skin, particularly on the fingers and the toes. And then this may eventually complicate to more serious symptoms like difficulty of breathing or shortness of breath, chest pain or pressure on the chest, loss of speech, movement, involvement of your kidneys and your other vital organs. Now, how do we manage as nurses? How do we manage patients with COVID-19? So since the manifestation will basically be somehow similar with that of the viral pneumonia, so nursing care is somehow similar with management of viral pneumonia, like having ineffective airway clearance. So this is due to the presence of thick retained secretions. So we provide the client with chest physiotherapy, increasing fluid intake, nebulization, oxygenation, and then mucolytic. We can also provide them with bronchodilators, postural drainage, and the like. Impaired gas exchange can prevent the lung, can be related to the lung being inhibiting the movement of the oxygen into the bloodstream and alters gas exchange. So we can, some patients with serious conditions or with difficulty of breathing can be intubated and hooked to a mechanical ventilator, and they may be given with the bronchodilators and inhalation nebulization. Another one is ineffective breathing pattern is related to compensatory mechanism related to tachypnea due to the inability to meet the metabolic demand. So we can encourage the client to do the deep breathing exercises and proper coughing exercises. Now they are also experiencing problems with nutrition. So they may have this imbalanced nutrition, less than body requirement, because they lost the sense of taste. So they don't have the appetite to eat. So we can provide them with small, palatable, and with consideration of the patient's food preferences, that is also high in calorie, high in carbohydrate, high in protein diet. We can also boost their immune system by providing them with plant sources nutrition, and like that of your citrus fruits. And then we can also prevent further systemic infection by administering antimicrobial as per doctor's order. And then the pain also, secondary to the coughing, strain the muscles that produces the pain. So we can advise the patient to do the splinting when they cough, proper positioning. We can also apply some massage oil to ease the muscle pain. And then they can also have activity intolerance due to loss of appetite and reduction in oxygen level in the blood, causing the weakness. So we can advise the client to be on complete bed rest. They can also have this emotional or mental depression, secondary to the idea that they develop a deadly disease and they are separated from their loved ones. No one can, no relative can take care of them. The time may come that they may uh, have this fear of dying from the disease, that they could hardly see their relatives even to their last breath. So emotional care is also very important, that we take consideration of their longing for love, their longing for their loved ones, longing for the warmth of caring. So nurses can really be of help, because they are the ones available at the bedside. So I remember one of the healthcare provider who hugged and who hugged the patients who is positive with COVID-19. Though he is protected with PPE, at least the fact that the physical hug comforted the patient with COVID-19. Up to this date, the management for COVID-19 is still, there is no specific treatment. And the management is still intensive supportive care. Antiviral may be given and other forms of antibacterial, but it is a case-to-case, on case-to-case basis. So management will be based on the signs and symptoms presented by the patient. Let's say they have this certain fever, so we give them antipyretic. So if they have difficulty of breathing, provide them with the breathing treatments. So that is how we manage the signs and symptoms of COVID-19.